Cervical cancer screening. If the patient's result showed normal cervical cancer screening, then the patient is going to go for the routine screening test every 3 years. So the routine screening is done every 3 years. If the result showed inadequate sample, that means we are going to repeat the cytology within 3 months. If the result of the cervical screening cytology showed ascus, that means atypical squamous cells of undetermined significance, then here we need to check for the age of the patient and the availability of the human papillomavirus testing. If the lady is less than 30 years or the human papillomavirus testing is not available, in this case we need to repeat the cytology in 6 months. If we repeat the cytology in 6 months and the result was negative, then we are going again to repeat the cytology within 6 months to check for the negativity of the result. If the result is negative, then we are going back again to the routine screening within 3 years. But if the result was showing ascus abnormality or more than ascus abnormality like ascus H or LSIL or HISIL, then we are going to do coloboscopy. We are going for coloboscopy. In another case in which the lady was more than 30 years old, here we need to do testing for the human papillomavirus. If the human papillomavirus testing show negative results, then we are not going to stop at this point, but we are going to repeat the cytology again within 12 months to find a negative result and then going back to the routine screening. But if the result was positive, then we are going again back to the coloboscopy. If the screening test showed ascus, that means there is atypical squamous cells highly suggesting high-grade squamous intraepithelial lesion, then in this case directly we are going to do coloboscopy. And if the result of the cytology was showing atypical glandular cells of undetermined significance, then we are going to do coloboscopy, and in this case we may need to add to the coloboscopy endometrial sampling to check for the presence of endometrial carcinoma. So we need to know these endometrial cells are coming from glands, they are coming from the endocervix or they are coming from the endometrium. This is why in some cases we need to go also for endometrial sampling. If the result of the cytology showed low-grade squamous intraepithelial lesion, in this case we have two options, either to go for coloboscopy or to repeat the cytology within 6 months. And in this case, we are going to follow the same procedure as in the ladies less than 30 years. We are going to check after 6 months. If the result was negative, then we are going for another 6 months. And if the result is negative, then we are going back to the routine screening. If the result was showing any abnormality in the first 6 months or in the second 6 month checkup, then we are going to go directly for coloboscopy. If the cytology results showed high-grade squamous intraepithelial lesion, then we are going directly for coloboscopy. We need to check for the cervical sample to check the presence of high-grade intraepithelial neoplasia, which are pre-malignant lesions. If from the cytology we found that there is a squamous carcinoma or any other malignant cells, we are going directly for coloboscopy. The presence of the high-risk squamous intraepithelial lesion indicate that in the coloboscopy we are going to find from the cervical biopsy we are going to find high-grade lesion, which is high-grade dysplasia. We are going to find SIN3 or SIN2. This is considered high-grade dysplasia. And in case of low-risk squamous intraepithelial lesion, this is going to most probably to give us in the colposcopy result, it is going to give us low-grade dysplasia. That means it is going to be sin 1. Any discrepancy between the result of colposcopy and cytology may indicate further workup and repetition of colposcopy and doing human papillomavirus testing. Thank you very much.